The segmental exam is more officially known as the Complete Bilateral Physiological Study. This test is an extension of the single-level ABI exam to include diagnosis at the calf and thigh. This exam allows you to determine the region of the disease. Have the patient lie down in the supine position, relaxed with head and heels supported in a comfortably warm room. Wrap appropriate-sized cuffs, usually 12 cm on the arms and 10 cm on the ankles, as explained in the section on cuff wrapping. Generally place the calf cuff just below the bones of the knee. For this segmental test, you may use a 12 cm or a 12 cm long cuff high on the thigh or a wide 17 cm contoured cuff. Connect the cuff link to the cuffs using the color-coded hoses. On the computer desktop screen, select the simpleABI Reports icon. When the screen opens, click on the File tab, then New, and then select the 3-cuff segmental report. Fill out the patient information, risk factors, current symptoms, and ICD codes, etc. Use the computer cursor and click on the right brachial field. Place the Doppler probe at an angle to the skin over the radial artery. Move the probe slowly back and forth until the strongest arterial signal is heard. Press and hold Inflate on the cufflink remote and inflate the cuff until you no longer hear the signal and continue for an additional 20 mm. Release the Inflate button and the cuff will automatically start to slowly deflate. When you hear the Doppler signal return, press the Pressure button and the pressure will be entered in the right brachial field. If you want to repeat the pressure, just repeat the process and the new pressure will replace the previous one. When satisfied, press Next on the remote and the system will move to the right DP. Again, take an ankle pressure using the Doppler probe, this time on the DP on top of the foot. Press and hold Inflate until blood flow is occluded, plus 20 mm. Release. And once blood flow is heard, press Pressure to enter the pressure in the DP field. Now press Next to move to the PT field. The PT artery is found roughly 1/2 inch below and behind the inside ankle bone. Obtain the pressure in a similar method as the other sites. Obtain a strong Doppler signal. Press and hold Inflate until blood flow occlusion plus 20 mm, release, and press Pressure when the sound returns, and the pressure will be entered in the PT field. Press Dump to prepare to take a PVR waveform. To obtain a PVR waveform at the ankle cuff, press the button with the waveform image on it on the remote. The cuff will inflate to the proper pressure and hold that while the waveform is obtained. 5 seconds of waveform data is captured after the cuff pressure stabilizes at 65 mm. The patient should remain still during the measurement. You can repeat the measurement by pressing the waveform button again. When satisfied, press Next to move to the right calf. The system will move to the calf location. Remember that the pressure depends on the cuff location, not the probe, so keep the probe on the ankle. You can use either the PT or the DP, whichever you found easier to find and maintain. Now use the remote by again pressing and holding Inflate to occlusion and Pressure when the blood flow returns. Press Dump to prepare to take a waveform. Press the Waveform button and wait a few seconds for the PVR waveform to appear. When satisfied, push Next and the system will move to the above knee cuff. Again, remember that the pressure depends on the cuff location, not the probe, so keep the probe on the ankle as before. Now use the remote by again pressing and holding Inflate until occlusion and Pressure when the blood flow returns. Press Dump to prepare to take a waveform. Press the Waveform button and wait a few seconds for the PVR waveform to appear. When satisfied, push Next and the system will move to the left brachial field. Repeat this procedure on the left side. At each site, find a strong Doppler signal. Press and hold Inflate until occlusion. Once blood flow returns, press Pressure. At the ankle and leg sites, also take a PVR waveform by pressing and releasing the button with the waveform graphic. When finished, you may add comments and select or add impressions if desired. Save or print the report by going back to the File menu.